Are we all experiencing some form of mental disorder?
Mental health is falling apart and what to do about it.
My anxiety creeps inside of me.
Don't do these 4 things if you want good mental health.
Here are 6 signs you're struggling with your mental health.
I had a bad mental disorder episode recently. It was really, really bad. Like, I've never experienced anything like this. So then I went to see my therapist and all, and she gave me the proper diagnosis and whatnot. But I then started thinking, after I got out of that period, started thinking, are we all experiencing some form of mental disorder? Because when I looked at the numbers online, when I was doing research for this video, it was truly, truly scary. The World Health Organization reports that the leading cause of death among young people in all socioeconomic situations around the globe is suicide. And 90% of that suicide is because of mental health issues. And that is scary. They reported 750,000 deaths in 2022. I think there were 727,000 deaths in 2022, actually. And around 1 billion people around the globe are experiencing some form of mental health. It is crazy. The numbers are truly, truly crazy. And even when you open your internet these days, all you can hear about is, oh, mental health this, ADHD this. And not only that, I checked a video online, and this doctor explained these as symptoms of mental health.
7 signs your mental health is falling apart and what to do about it. Number 1, constant fatigue. Number 2, you isolate. You stop replying. You cancel plans. You just want to be left alone. Number 3, you're constantly irritated. Number 4, the future feels hopeless. Number 5, appetite changes. Number 6, your sleep is suffering.
These are all things that my friends and I, or people that are close to me, have experienced. So why are we not talking about it? So in this video, I really want to unpack that, right? Welcome to Let's Get Uncomfortable. My name is Netemba Veni. I am an economist, and I really like to talk about topics that are on everyone's minds. And the issue that is sort of plaguing everyone these days is the mental health crisis that we are all experiencing. But it is not spoken about, especially in poor Black communities, right? So I want to do a few things in this video, right? The first one is I want to understand what exactly is mental health. And number 2, I want to understand why it has become so popular these days. Every time you open your phone or your internet, you look on TikTok, you look on YouTube, everyone is discussing mental health. Number 3, also understand why we don't discuss it in poor Black communities. And lastly, is there anything at home that you can do sort of better your mental health in a sense, if you cannot afford therapy, for example? And by the way, this does not apply to everyone, and this is not medical advice. This is just things that I found to be helpful when I was going through my issues recently, right? So on the first one, what exactly is mental health? Now, there are plenty of definitions, official definitions of what mental health is. And I guess from just the name itself, we can sort of conclude that it's just how healthy your mind is, right? But I did find 2 definitions. The one was from Jordan Peterson.
Your mental health is the harmony of your existence in relationship to the future and other people. That sense of well-being that can infuse you if you get the balance right isn't a reflection of the proper function of your mind or your brain. It's a phenomena that emerges when everything is in its proper place and operating harmoniously.
Okay, that was very confusing to me. So I looked for other definitions.
Our mental health exists on a spectrum or a continuum. At one end we have illness, at the other end we have health. With our mental health, when we feel low or we feel stressed, our mental health can also start to go down the spectrum. And this is normal, and it fluctuates day to day throughout our lives.
And then this one really, really hit home when I read it, and when I watched the psychologist explain it, and he said, you don't have to look at it in terms of oh, good or bad, that, oh, I have a mental health, my mental health is not great, or my mental health is great. Just look at it as a spectrum, right? On one hand, you have you have disorders, or you have ADHD, like I said, you have bipolar, you have anxiety or depression, and on the other hand, your mental health is healthy. Like you are happy, you are content, not happy. You're content all the time, and you're sort of not stressed out. You don't feel hopeless, etc. And you sort of are on the spectrum continuously in your life, depending on where you are, depending on like environmental, socioeconomic factors, depending on sometimes generics, like sometimes mental health issues that you got because there's a history of depression in your family, for example, right? So why has it become so popular? Now, there are a few reasons that we can discuss when it comes to why this became popular. The first one I heard was from this psychologist, Dr. K. And no, he's a psychiatrist. He's a psychiatrist, Dr. K. And I love him. I love his videos so much. He's great. And he's a little bit funny sometimes. So he said that social media is the biggest one. By social media, I mean that just how many hours you spend online does have an impact on your mental health. And we know this, right? I know this myself. Like recently I would like start waking up. So in an effort to sort of help my depression, when I went through depression recently, instead of in efforts to help my depression, I would wake up early in the morning, and like for the first 30 minutes, I would just like have a cup of coffee and not do anything and just not think about anything and like just not look at my phone, not look at my emails. And then after that, I'd go to the gym, and after I come back from the gym, I'd shower, and then I start commuting to work, or I start working, whatnot. And that time I did not, for the whole week, I did not go on TikTok. I'm not a big TikTok person, but I like YouTube. I didn't even go on YouTube. And I felt like you feel it immediately. The less time you spend on the internet, the better your mental health is. And it brings up a lot of things, like being on the internet. You sort of, especially if you're on like your Instagrams. I also don't have Instagram. So, but when I did have Instagram, whenever I'd go on Instagram and I would see like my friends from high school, my friends from varsity, who are like doing so much better than me, who are sexier than me, who are prettier than me, who have like partners now, who are married. I would just scroll, and just as soon as I put my phone down, I start rethinking all of my life choices, rethinking whether or not I'm doing the right things with my life. Why am I not sexy? Why am I not pretty? And that was very helpful, right? But then when you remove all of those things, the only thing you can truly, if you think about it, focus on is yourself and how you can better yourself the next day, or like, in the next hour, or in the next action, because there are no external factors. But if you spend so much time feeding your mind that, and you may not think that you're doing something wrong in the moment because you're just like scrolling mindlessly, but your subconscious does capture that, and all of that is data to your brain. And you sort of, comparison is never a good thing, right? So social media is a big one. The second one is reporting, right? I think it's being reported more now, and like a lot of experts on the, online will agree that there certainly has been a lot of reporting on these crises, which is great in my opinion, because you need that. Back then, I don't think, like back in the medieval times, or even back in like in the 50s and like the 40s and the 60s, I do not think that people even understood the idea of mental health. I don't think people, because you don't understand it, then you don't put the efforts and the time and the resources to researching it. So there was probably an issue with substance abuse like there is now, and alcohol and whatnot. And people would just look at that as in like someone is an alcoholic or someone is an history of drug abuse, but not look at the underlying issues. So then you obviously not going to report it. So now there's more reporting. And a third reason is like, this is like it could be a culmination of all other things that are happening around the globe, which honestly is confusing to me, because in terms of like statistics, this is the safest we've ever been as nations. Like despite all this, I mean, this might not seem true now because of all the wars that are happening in the Middle East and, whatever's happening in the US. But in general, it's not as bad as it was during war times, and when we had like plagues, and we had like, your all these diseases that we're not treatable. We are sort of in a better, situation as society, you can argue. But still, all of these other things like especially I'm going to speak about the South African context, like the high levels of unemployment. All of those things are playing a role essentially in how people feel about themselves, and all the depression, rates, and therefore that translating into substance abuse and crime, right? And then the last one, which people honestly have a hard time, coming, into terms with, is diet. We all hate hearing this, don't we? Like diet and sleep, those two things, we hate hearing about them because they seem so hard to do. Eating healthy seems like so hard. Like it's so easy to just order something and then watch TV and just eat your nice burger and fries and just forget all your problems. But in the long term, that's not going to help you, right? You need a balanced diet. You need to move your body. Those things do, and you need to sleep. So all of those three things, diet, exercise, and sleep, are essential. And we're going to talk about them in the last chapter of this video, which is what can we do? But we don't like talking about those things. And I don't know why. They are important. Essentially, is what I'm saying, right? Why? The third part of the video is sort of discussing why we don't talk about mental health, especially in poor Black communities. And I thought of a few reasons. The first one, which is very true, is it's not really a priority. I think with my family right now, my people have issues. There's the issue of the economy. People don't have jobs. People don't have, enough money to buy food and clothes and all of those things. And if you are in security and safety, so if you're worried about those basic needs, basic human needs, thinking about your mental health is really not going to move the needle, because you won't even be able to afford therapy. You won't even be able to afford the things that you need to then better it, right? Outside of the things we're going to talk about in the last chapter, right? So, which is very ironic or counterintuitive, because I can argue that 80% of the reasons that we have such high rates of substance abuse in the country is because of mental health. We do not have time for mental health because it's not a priority. Can you see how counterintuitive that sounds? So that's the first one. The second one is just discomfort. Having meaningful conversations that are gonna grow us as people, and are gonna make our relationships better, is just a hard thing to do. It's very difficult and it's uncomfortable. Therefore, why not avoid it? Essentially, let's just avoid it, and let's just drink and take drugs or fight. So it's sort of yeah, I don't know. And that does not only apply to mental health. I think that applies to just all relationships in general. Just having hard conversations is just difficult. And talking to your grandmother or your Black mother who survived apartheid, or who's struggling to make ends meet, about how depressed you've been and how you are really hopeless about your future and how you feel like you have no purpose, is a hard I'm going to tell you now, I would never have the conversation with my grandmother, the woman who raised me. Even when I had my depression recently, I do not even mention this to my family, because I'm no one is going to understand what unibipolar depression is, and no one is going to really care about it. They're just going to be oh, it's like a Santon disease. Santon is like a rich square mile in Africa. Yeah, so they're gonna be it's why people think, why are you even talking about that? So I guess discomfort is one of those reasons. And also the last one is the lack of knowledge. We don't know a lot about mental health now, do we? We never learn about it in school. Our parents are not exposed to that kind of content online. If you think about what your parents watch, it's usually the news and things about someone selling things about religious stuff. It's never really about, how to better your mental health. And so they never understand, unless maybe sometimes they really have to learn about it because their child is exposed to that. But apart from that, we really aren't exposed to that kind of topic. And hence, if you don't know something, how are you even going to discuss it? So then lastly, I want to talk about things that you can sort of do. As I've mentioned, I also went through this recently, and what I found to be helpful is one, routine. I cannot stress this enough. you need routine, because then it sort of removes the anxiety around planning your day. And if you're already like depressed, the last thing you want is sort of think about, oh, what am I going to do next? So just like have a predetermined routine and just follow it. Number 2 is to follow that routine blindly. What I mean by that is, don't overthink it. If you said to yourself, you know what, you sit down, you're like, okay, if I wake up at 7 a.m. and I go to the gym and I come back and I make a healthy meal and I get a cup of coffee and I go to work and I come back and I sleep. And that is very simple. Don't overthink it. In the morning, just go. Wake up and just go. And just like, whenever you want to, you think of ordering a meal, just take a deep breath and like, okay, you know what, this is what I'm supposed to do. I'm just going to start and try and make something healthy in the house. Third one is move your body. Now, you don't have to, if you can afford to, you can obviously get a gym membership and whatnot, but you don't have to do that. You can just walk. Walking will have like a great effect on this. Like moving your body, going outside, getting like the sun is going to be so helpful. And the third one, I think, wait, 1, 2, 3. For the fourth one is, what is the fourth one? Oh, the fourth one is sleep. Now, this was the most difficult one for me, because it's sort of hard to fall asleep when you have a lot on your mind, is it? So what I usually do then is I call sleep training, which is wake up at the same time every day, no matter how tired you are, right? So even if you sleep at 4 a.m., right, because you've insomnia at 2 a.m., just wake up at 7 a.m. regardless, every day. So your body will get tired eventually. Like, it don't take naps. Your body will get tired and eventually you start sleeping at an appropriate time and waking up at the appropriate time. This will take like 2 weeks max, honestly. Like around 2 weeks, you will start sort of fall into a good pattern. And trust me, you will feel the impact almost immediately. Like I said, after a week or two, if you cut down social media, again, this is the last one, sorry, social media as well. So if you start moving your body, you have a routine, you follow that routine, you eat healthy, you sleep, and you limit your time on social media, you will feel the impact of that almost immediately. I can promise you that. And maybe we'll have a better nation for all. That's it from me on this video. Thank you so much for watching.